Dear cardiologists, we want to make this podcast about you and for you. So please email us your critical thoughts, comments and questions at podcast@radcliffe-group.com and visit uscjournal.com for more information. You can also follow us on Twitter, LinkedIn, Facebook and Instagram at Radcliffe Cardiology for daily updates. Join thousands of cardiologists and become a Radcliffean by registering to radcliffecardiology.com. You will receive regular newsletters and gain access to hundreds of expert interviews, educational webinars, clinical cases, and peer-reviewed articles from our 6 medical review journals on general cardiology, interventional cardiology, arrhythmia and electrophysiology, cardiac failure, and vascular and endovascular surgery. Thank you.
Hello, everyone. I have the honor and privilege of having with me a very special guest today. I've known her in person. She's helped me out tremendously over this past year. Her name is Kavitah Chinnaiyan. Dr. Chinnaiyan is a cardiologist at Beaumont in Royal Oak, Michigan. She's also an author of 2 exceptional books. One is Shakti Rising. I think this is the second book that came recently. And then the first one is The Heart of Wellness. So it's my absolute honor and privilege to welcome on the show Dr. Chinnaiyan. Kavitah, welcome.
Thank you so much, Ankur, for your kind introduction.
Yes, I mean, we've talked a lot about, burnout, off the record, as you know, and, I sort of reached out to you last year when, I was dealing with a lot of turmoil in my life, and I started following your practices of meditation, which have helped me tremendously, and I think if you think about our professional lives and our personal lives broadly, I feel meditation is something which at least in the generation that I'm in, and I think I may be a senior quote unquote millennial, but at least in the millennials is completely absent. I mean, the concept is lacking, and also the concept of mindfulness is lacking, and that's where I think burnout is becoming such an issue. But maybe it applies to all of us as broadly and vastly. So, thank you for coming on the show and agreeing to discuss these topics which have become very relevant, on a global scale. And I would like to start the conversation by having you discuss, just the broad issues of burnout. What do you think are the causes of burnout, and what is exactly burnout?
Yeah. And thank you for sharing your experience, because, I do think that being vulnerable enough to discuss our personal issues around burnout is really a sign of strength, and we don't see it that way. But we'll talk more about that later. But coming back to what is burnout really, and it's really a syndrome of psychological and emotional issues that emerge because of this prolonged exposure to stress. And it's stress related to our job, which is doctoring, medicine. And so it has, the syndrome has this conglomeration of symptoms, including exhaustion and this feeling of, being detached from what we do, a lot of cynicism, as well as, this pervasive sense of not accomplishing enough, of not being effective enough. So when we take all of this together, in various combinations, then that is the definition of burnout. And although we are specifically talking about burnout in medicine and specifically cardiology, this is a pervasive societal issue. It's not that other fields are actually exempt from burnout, because this is a societal issue. It's a cultural and social issue rather than a medicine-specific issue, if that makes sense. So it is really stress. That is the fundamental reason for burnout.
Yes, I think you've explained it very eloquently. You've described it very, the way you've described this is very relevant to how, it may be perceived at work and also in our personal lives.
Yeah.
And I sort of want to get to the root cause analysis of, what is happening in our work environments. What do you think is happening in places where we go to work every day? Is there a disconnect amongst colleagues? Is there a sense of competition amongst colleagues, which is not healthy? I mean, a competition should be very healthy. And I think healthy competition is what paves, the path for, discovery and, refinement of not only, technology and science, but also, different workflows. So, I think healthy competition is important. It's important for a continued refinement. But, on the other hand, competition could also be a very negative emotion. It could be perceived very negatively. It could be disseminated very negatively. Um, it, do you think how we're interacting amongst one another at work has something to do with burnout? Because as I was preparing for this conversation, I did a quick search of the National Medical Library to see when burnout started appearing as a term in the medical literature. And this sort of dates back to at least in pathology and radiology, like all the way back to the 70s. But you don't see burnout sort of becoming a phenomenon that it has become until perhaps the past 10 years. I mean, the past 10 years there's been a surge in the term burnout. There's been a lot of medical literature on burnout. So I'm sure, medicine has been practiced for decades. And is it something that we are doing, the millennials are doing, or is it something that the current physicians in 2019 are doing, which is different than what our colleagues or our seniors were doing back in the 70s and the 80s?
Yeah, that's such a good point, right? Because when we look at how medicine is practiced now, even since the time I graduated, things have changed so much, and that's just in the last 15 years, and even more so in in the last few decades. And it's primarily a few different things that we can potentially point a finger at and say, well, these are probably the causes for burnout. There are two broad issues here. One is the systems issue. Just this whole system in which we practice medicine. That is one broader issue. And then the second aspect of it is the individual issue. Of course, they are both connected because the system is made up of individuals, and we are the system. However, the system, when I say system versus individual, the system is composed of things that are beyond our control, as individuals. And that has to do with the changing landscape of healthcare, which is a loss of autonomy in terms of what we can do with patient care. For instance, it's being told what we can do, and all the regulations around, whether it is around testing or prescribing, or being really worried about litigation, because a lot of us practice, and we are taught to, and we are expected to, and it is it's something we need to do, which is defensive medicine. And in societies where there is a risk of litigation, we tend to practice medicine not simply for the joy of it, right? Not simply driven by the joy of the human connection we have with another patient, with another human being, and the joy of being able to contribute and serve, which is what brought us to medicine in the first place. So instead, once, we innately, all of us in medicine, most of us in medicine, have this innate desire to serve and to do good for society and to contribute in these meaningful ways. I mean, think about it. Who in their right mind wants to go through decades of training to be a specialist?
I agree.
Right? I mean, if nobody in their right mind wants to do that, if they're thinking that's the career path, particularly because it's not all fields in medicine are where you make a lot of money, right? So it's not, we are not driven, but we are driven by this wanting to give ourselves. And when we think about what is it that we want to give ourselves, it is fundamental human connection. We really want to connect with others because we have that empathy and that really the flowing of that wanting to be of service. And then we come into a system where we can't do that, right? And we have to operate under all of these restrictions, despite the fact that we have spent decades in training and have given up our own freedom, and we've made so many sacrifices and stayed up all night and calls and all this, the brutality of the training of medicine, right? So there is a fundamental kind of a mismatch between what we've put in versus what we can actually do. And so the dream, the original dream that sent us on this path feels like it's fragmented. It's like, and so we become cynical, right? Because it's not the way we were hoping it would be. And that is because of all these restrictions from the system, which is the hospital administration or whatever it is that control, and the third party payers, and then the regulations and so on that restrict us from actually providing the care we want to provide. And that is now being called moral injury in medicine. And I think that's a huge part of it that leads to over time. And, even I'm sure you can relate, and I can also feel this, is when we first graduate from training, that enthusiasm and the joy we have for practicing medicine starts kind of waning as we have been in practice for a few decades, because then the reality hits us, right? And so there is a lot of that contributes to this sense of disconnect from our original dream of being a doctor. So I think that's a huge part of it. And then, what has happened in medicine, unfortunately, I mean, you and I both go to a lot of the, meetings, right? The national and international and local statewide meetings.
Sure.
So when you go to these meetings, what is it that we talk about when we talk about patients? It's day in and day out of data, right? It's all about data, right? It's this paper showed this and this study showed this. Nobody is really talking about the human aspect of medicine. So we come back from these meetings, and then we are face to face with the patient, and we realize, well, oh wait, this is not data. This is actually a human being here, right? So it's become what has happened, in our pursuits, which is a very noble pursuit of evidence-based medicine, is that we have forgotten, we have kind of left behind the human aspect of medicine, the art of medicine. At no meeting that I go to have I heard anyone talk about, the fundamental the qualities that bring us to this, field in the first place: love and compassion and gratitude, and all these things that make this field so worthwhile. Nobody's talking about that. We are only talking about data. But we are humans, right? And we don't operate just on the intellectual level. And so there's a huge disconnect between what we are taught to do and how we are innately, which is, we are complex beings of emotions and a mind and relationships and all of that. And somehow we push all that aside and we've made it so sterile that we ourselves can't take it. There's a fundamental disconnect there between who we are and what we are taught that medicine is. So I think that is a big part of this burnout too. And as you were saying, it is this insane competitiveness. It is over competitiveness. I completely agree that competition is very healthy. It drives us to excellence and it drives us to fulfill our potential. But there is a fine line between healthy competition and insane competition, right? And
Yes.
You have a young child, and I have children who are in high school. And let me tell you, just getting into college, you would think is like going to Mars. It is that insanely competitive. It's needlessly competitive. Secondary education should not have to be so competitive, as an example. And just getting into medical school, getting into residency, and then even after we have graduated, there is this, it's this competition to stay on top. If we are in academic medicine, we need to be constantly producing and publishing papers. If you're in clinical medicine, you constantly need to be meeting your RVUs. So it never ends, right? It never ends where we can stop proving ourselves and take a deep breath. So there is that too.
Yes,
What do you think?
Yeah, no. You've touched upon several very important topics. In part, I think there's a paper in review. So I can't talk much about it, but there's a paper in review which I authored with one of my colleagues. He's also on the editorial board for Radcliffe Cardiology, Dr. Narang at Northwestern University. And what we've discussed, we're both in the early career phase of our careers, and what we've discussed is the paper's titled Schadenfreude, which is actually a German term. It's a German word, and what it entails, or what it means essentially, is that you take pleasure or you take joy in the misery of others. And it's a complex emotion if you think of it. If you think of what I've just described, you'd be like, something's wrong with this person. Why would someone else take joy in someone else's misery? But it's a complex emotion of envy and jealousy. And what we both feel and think is that it's prevalent in medicine, and it's sort of delivered to you in a very subtle way, in a subtle fashion. You want to question it, you want to doubt it, because you want good for everyone. As a physician, like you said, physicians embody the emotions of love, empathy, and compassion. And as much as these words are being thrown around in the lay press or in the medical literature, it's compassion and empathy are two words which I feel you really have to start practicing them, or else you can just say them for saying them but not really realize what they actually really mean. And so on one hand there's empathy and there's compassion and there's love, and then on the other hand there's Schadenfreude, which is something that we've written about, but it gets down to the point of being competitive in a negative way. And what you said is of importance, of significant importance here. But before I get to my next question, I do want to explore this concept of Schadenfreude with you, because you obviously are a practicing cardiologist in an academic environment. And, like you said, whether it's clinical medicine or academic medicine, it's either production of relative value units or it's production of publications or papers.
Yeah.
And, it's metrics after metrics after metrics without actually looking into the human aspect of the physician well-being. So before I get into how can we balance the insane competitiveness in our work environments with resilience, I do want you to discuss a little bit about Schadenfreude. What do you think about this term? And, if you think if it's relevant at all at the first place.
Yeah, absolutely. I think it is time that we talked about this. What I think is the fundamental problem is that we assume that just because somebody comes into medicine or that they have been accepted to medical school and then they go through years of training, we just assume that they are psychologically and emotionally perfectly well adjusted. And that's not true.
Mm-hmm.
That's absolutely not true, because if we are driven by a fundamental sense of not being enough, which is 100% of us,
Mm-hmm.
We come to this with wanting to prove ourselves in various ways,
Mm-hmm.
and as an example, I was born and raised in India,
Mm-hmm.
and when I first came to this country, I heard this term, number one. Somebody gave me advice when I was in residency or first year of fellowship, saying, you should look out for number one.
Mm-hmm.
I didn't even know what that meant. I
Mm-hmm.
had to ask, what does that mean? What is number one? And so this is this individualistic way of being, right? Which is, there is room on the top for one, and I need to be that one. It is this, and I need to be there at all costs, no matter who is pushed back in that process. And so there is a lot of emotional and psychological kinds of games we play with ourselves and with others, and we don't realize that because we have never been taught in our primary or secondary education about being really emotionally well adjusted. Very few of us actually even understand how the human mind works, especially our own, right? We haven't had the interest or the ability to look at our own minds and look at our own, non-serving patterns. So we don't do that. And so, and we don't do that, and it's kind of normalized. Everybody in this society is doing that, looking out for number one. So it should be a normal thing where I'm also looking out for number one. Whereas, when we approach something with this attitude of this extreme individualism where I need to be successful, well, there is this issue of defining success, which we can talk about later, but that is what leads to this whole thing of this undercurrent of envy and undercurrent of this, this kind of resentment and this, of course, and all of this is driven by that fundamental sense of lack that has never been resolved. And so it just is a whole, it's like a cauldron of various things that are going on within our own internal landscape that we don't even pay attention to. So what you're saying is absolutely right, absolutely true. And we feel it also like in our professional organizations, right? It's very cliquey. Don't you feel that?
Yes,
it's
I do.
Like there's an inner circle, and that inner circle gets to make all these decisions about whatever it may be, whether it is, how the field should be moving forward, or what regulations we should be fighting for, or who should be part of that inner cycle, in that inner circle, right? So all of that is driven by this fundamental sense of lack, and we just don't understand that. But what is important to realize is that it's not specific to anybody. This is just the function of being human. And all we need to do is really look at all of these complex psychological issues within us, because unless we are willing to do that, we can't really understand our own minds. And it just leads to more and more stress, because you're always going to find, and I don't know if you ever heard this in India, but when I was growing up, and I used to hear this all the time from older relatives that would say, there's always going to be somebody better than you.
Yeah.
And there's always going to be somebody who's going to be behind you. So, keep grounded, and don't chase after that so much. And my dad sat me down when I was thinking about going to medical school and grilled me. And he said, "Why do you want to go into medicine? I want to know." Mm-hmm. And he said, if you're not going to, if serving, without self-serving desires is not your intention, I don't want you to be going to med school. If you think you can make more money, or you can gain fame, or you can get notoriety, this is not the field for you. There are other fields. And he said, you're going to be exhausted. It's going to be too much for you. Do you think you can do it? And so I think that's the kind of advice and conversation we need to have with, our younger colleagues, and really, help understand this complex, psycho-cultural, social kind of a matrix that gives rise to this burnout, because it's a very complex issue, right? There isn't one thing that causes burnout. It's this whole messy combination of things.
Yeah, no, I completely agree with you. I mean, so I was born and raised in India as well, and it's fascinating that you bring up points on discussions like there's always going to be someone better than yourself, and that was something that I was always told by my parents. So they actually said that the only person that you compete with is yourself, right? Because each time you want to do something, to better yourself, keeping yourself as the benchmark, and then becoming a new benchmark for yourself each time you want to do something more, or something new, or something different. Because if you start comparing, or if you start competing externally, you would always remain unhappy, because there's always going to be someone better. Coming back to your point. And and then you really have to be mindful about what you are trying to achieve. Like, what is your goal? What is your mission? And where do you want to get to after all this competition? Because you really, at the end, everything is in your mind. Everything is a function of your thought, and everything is a function of your mind. And if you cannot be mindful and thoughtful of who you want to be and where you want to get to, then this entire exercise is pointless, is worthless. And in bettering yourself, and in refining yourself, and in making yourself as the benchmark, the hope is that one day you will find yourself, which I'm going to, I think, would be a good sort of ending discussion for just this concept, and going on to resilience, is how in the midst of competition and envy and schadenfreude, if you will, some people think that it does not exist. Some people, obviously you and me are in that category, who think that it does exist. How do you then nurture resilience? Because I think resilience is so important in surviving the current healthcare environment. How do you nurture resilience as a habit, and as something that you practice on a day-to-day basis? Is finding joy and finding identity outside of your work, maybe, perhaps, is how I think of it. But we'll obviously see what you have to say on this.
Yeah, absolutely. I think we should define what resilience is, which is the ability to withstand threats that can seem like they're going to impinge upon our well-being. And so when we say resilience, it's really dependent on so many, these adaptive mechanisms to stress, right? So the stress is a perceived threat to well-being, which is beyond our capacity to cope. And so you can imagine that for one person, being stuck in traffic is very stressful, and whereas for somebody else, it's nothing. And even being in a very difficult situation, such as war, is okay. They have the ability to handle that. So stress has nothing to do with the external factor, right? Stress is everything about whether we have the capacity to deal with these threats to our well-being or not.
Mm-hmm.
And so the resilience, it is really an adaptive mechanism, and it depends on various things. It depends on our stage of development. If we have had severe trauma in our early childhood years, and if we have really a maladjusted personality, then we tend to be more stressed and have more of these experiences of stress. So there's that stage of development. And we also have the influence of society and culture. And so it's what is really important with regard to burnout in this aspect is it's not that we are not physically capable, right? I mean, look at us physicians. We have a whole lot of resilience in many ways. I mean, we have gone through years of training and difficult years of training, right? And stuff that most other people would find stressful. Like when you are dealing with really sick patients and all that, we have dealt with all of that. So it's not that we don't have the resilience already. We do. But it really has to do with the unseen aspects of resilience that we lack, which is we are we are taught to build this persona that is like steel. That don't get emotionally involved, stay a little bit far away from all of that, and you just need to toughen up. That's what we are taught, right? In our medical school training and in our entire medical training, we are taught to toughen up and not be vulnerable. And so that becomes our default kind of a thing in the way we practice medicine. So you see how that's a cultural influence of medicine in resilience, right? And of course, in regards to resilience, there's also the intensity of the stress. I mean, for some people, even though they are very resilient, it can be too much, which is exactly what is happening in burnout, right? Even though we have spent so many years in tough training, now this external situation is too much to handle because that resilience that we thought we had was really, and it was kind of like a superficial toughening up rather than working towards the core, which has to do with everything that you were saying earlier, which is this mindfulness and the sweetness and the joyfulness and importantly, inclusivity. If we think that I am self-made and I am going to be on the top of this, mountain of elitism, and I have so many papers, I am so wonderful, then we are always going to have, situations where we are shown that that is not the case, that there is something else that needs to be developed, and that can become like a huge stressor. So how do we build resilience? And, I'm a meditation teacher, so I'm biased because I teach it, I practice it, and it has been life-changing for me and everybody that I teach meditation to. So something I recommend very, very highly. And also his changing our language and the way we think about certain things, right? For instance, self-worth. I was thinking about this today. Think about how we say, with regard to, famous people or rich people. So-and-so is worth so many $1 million or billion or whatever, right?
Yep.
So we are equating worth with that. We are equating worth with what you have rather than what you are. So it is this language that we use on a day-to-day basis makes all the difference, right? Because, does that mean that if you don't have that, you're worth nothing? So, but even though we don't think that, language defines how we think about things. So
I agree. I agree.
So there's that.
Yeah, no, I mean, you've obviously touched upon meditation, which I think, so for the listeners, we're doing a mini series on burnout and resilience and how to practice mindfulness with Kavitah. And, this would be a conversation for the next episode. But what you said is very important. And I just want to reiterate that language and how we have conversations, not only with peers and family members and friends, but also with ourselves. Because, to me, I think that the longest conversation that we have is a conversation with ourselves.
Yes.
And
it's an ongoing thing, right?
Yes, it's
always going, even in our dreams.
I agree. It's incessant. It's ongoing. It's relentless. And I think it's very important how we speak to ourselves. And this is something that I've started imbibing more so within the last 1 year, and that is how I am addressing myself when I'm having a conversation with myself. Because it turns out, and this is, I'm not making this up. This has been shown in various psychiatric models or psychological models, is that if you start addressing yourself as a third person, I'm not trying to promote narcissism or anything like that, but it's and again, this is backed by evidence, and we've talked about evidence-based medicine. But if you start having a conversation with yourself as a third person, you start forgiving yourself more. You start relying on yourself more, and you start breaking boundaries more. You start challenging yourself more. I don't know if you've experienced that. I certainly have. And
I think that's absolutely true, and that's that's one of the many ways that we can actually work on resilience, which is changing the tone and the voice in which we speak with ourselves.
Yeah, I mean, it's true. I mean, just to cite an example, for the audience or for the listeners. I mean, one thing which I would say to myself in moments of turmoil and emotional turmoil, or just turmoil at work, or just feeling feeling the heat, so to say, from colleagues or peers or from administration. I would simply say to myself, I would have this dialogue or this conversation with myself, and I would say, Ankur is a champion, and champions need challenges. And that's what would make me keep going, going forward. And I think if you sort of have that conversation with yourself as a third person, I think it makes a lot. At least to me, it did. It made a lot of difference to me. So.
Yeah, that's beautiful. I like that. And more than anything, I'm just astounded in a very, very wonderful way that we are actually speaking about this as two cardiologists, which almost never happens.
No, I mean, I think, the reason why we think these conversations are important, obviously Parallax is a podcast on science and on all the literature which is published in US Cardiology Review. But then we started having, conversations on vegetarianism, conversations on medical portraits in hallways and conversations on diversity and inclusion. This is the last conversation I had with Madhav. And we sort of started getting this feedback from our audience that, we like these themes. We like you to delve more into these themes, because nobody talks about these concepts and these emotions and these challenges, which are non-scientific but very professional, because this is something that we are going through or facing on a day-to-day basis in our work lives.
Yeah, absolutely. And people like it. I mean, I like it and you like it, because this is the kind of thing that we crave and we don't get it. It's kind of pushed away. This very human stuff, the art of medicine, the art of being human, I should say, not just medicine, that we all crave so much and which drives us on a moment-to-moment basis, is pushed away from how we practice medicine, as if it's two different, unrelated, non-interacting spheres. And that's why bringing this conversation back is so important, and I can't wait to talk more with you next time.
Yeah, no, thank you for your time. We've gone a little over time, but again, I think these conversations are meant to be cathartic, and they're meant to be self-reflective, and we want to extract and excavate topics which are relevant to us as professionals, and the hope is, and the aspiration is, that through these dialogues and these conversations, we're actually helping each other and helping the community at large in becoming more mindful, more compassionate, more involved, and more engaged at work. So, thank you for your time, and I will circle back, and I'll have you again on board for the next segment of these mini series on burnout and resilience. So thank you once again, Kavitha. It's been my absolute honor and pleasure of having you.
Thank you so much, Ankur. It's always wonderful to talk with you, and I'm looking forward to talking again.
Great. Thanks. I'll talk to you soon.
Okay. Bye.
Yeah. Bye-bye.
Welcome to Parallax by Ankur Kalra, a podcast produced by Radcliffe Cardiology to bring you a new angle of all things cardiology and the best from the US Cardiology Review. Published every second Monday, Ankur Kalra, MD, interventional cardiologist at the Cleveland Clinic in Ohio, USA, speaks with legendary cardiologists, reviews late-breaking trials, and interviews authors of our latest and best US Cardiology Review articles. We call them #audio articles. Parallax is the effect whereby the position or direction of an object appears to differ when viewed from different positions. So this podcast is your fix of reliable updates on all things cardiology by someone from a non-traditional background who is always looking at the industry from a new angle. Now, here's your host, Ankur Kalra, MD.